House will come to order. Majority Leader Pepin.
Thank you, Mr. Speaker and members. I move to suspend Rule 1.50 so that the House may meet past midnight for the first time this session.
Discussion. Minority Leader Hortman.
Thank you, Mr. Speaker. If the Majority Leader would yield.
She will yield. Representative
Just
Hortman.
a question on the provisions for members who might get into a state where they'd be too tired to drive home. What sort of provisions would the majority be making for people who can't safely get home tonight?
Majority Leader Pepin.
Thank you, Mr. Speaker and Representative Hortman. You would request Speaker Doubt ask him to get a hotel for the evening. As you know, under rules, we do have a provision for members to get lodging in situations like this, so you just have to put in your request to Speaker Doubt.
Minority Leader Hortman.
Thank you, Majority Leader Pepin. I appreciate that. I just would not want the work that we're doing here tonight to put anybody in harm's way, and I hope that people will take the Speaker up on that opportunity if they feel it's necessary. And Mr. Speaker, I would encourage members to vote yes.
All those in favor of the motion, please signify by saying aye. Aye. All opposed, no. Motion prevails. Messages from the Senate.
Message from the Senate. Mr. Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments and concurrence of the House is respectfully requested. House File Number 3202, an act relating to health. Message is signed Cal R. Ludeman, Secretary of the Senate. Schomacker moves that the House concur in the Senate amendments to House File Number 3202 and that the bill be repassed as amended by the Senate.
I recognize the member from Rock, Representative Schomacker, to your amendment. To your concurrence.
Thank you, Mr. Speaker and members. This is the bed moratorium bill from Regents, the request from Regents Hospital. Went over to the Senate after we put up a very strong vote in favor of the 76-bed proposal that had been put forward. The Senate had some other ideas, and now it's come back a little bit smaller than what it was before. The request that we'll be voting on tonight is a total of 55 licensed beds, 15 of which are designated in statute for mental health and 5 short-term stay beds there. There is a letter that is being handed out now, members, and that comes from the President and CEO of Regents Hospital, the Senior Vice President and CFO from Fairview Health Systems, and the President of United Hospital, that spells out the agreement that they came to. I will say that I believe that negotiations on this between the 3 hospital systems started in earnest maybe last night, maybe this morning on some of this, and that's where they were able to get to, and so this is where we're at. And I would ask for your support.
Discussion to the Senate amendments. The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker, and thank you, Representative Schomacker. Well, I think this is moving in the right direction, and I'm glad to see this is kind of the middle ground between the amendment that Representative Peterson had brought to us and the original amendment that Representative Schomacker brought. So I will be supporting this. I do note that it still doesn't say anything about the time in it, whether that's, you know, the initially Regents had talked about having a shorter request, because originally they were talking about over about 20 years. But I certainly think this is improved from where we were before. We do still have some work to do on this whole process to make sure that this isn't just a negotiation between competitors and having the competitors decide what's in their best interest. This should really be about what we, the legislators, believe is in the best interests of our constituents and the state as a whole. But I'm going to support the amendments that were made. Thank you.
Further discussion to the Senate amendments. The member from Dakota, Representative Peterson.
Thank you, Mr. Speaker, and I just want to thank Representative Schomacker for working with all the different stakeholders, and I'm really glad that the hospitals could come together and come to an agreement, and I'm happy to support this concurrence.
Further discussion. The member from Hennepin, Representative Carlson L.
Mr. Speaker, would Representative Schomacker yield to a question?
He will yield.
Representative Schomacker, you identified in your presentation the beds for mental health had been reduced from 20 to 15. And do you know what the overall need for mental health beds is in the state of Minnesota? Because I've got a feeling that we were moving in the right direction, but even at 20 beds, we weren't meeting the demand.
Representative Schomacker.
Thank you, Mr. Speaker, and Representative Carlson. To the point on the mental health beds piece, the number that is in statute moved from 20 full mental health beds to 15 that are designated for that. But in the letter that was also passed out from the hospitals that came up with the agreement, there still will be 20 beds. It's just that 5 of them will be short-term stay beds for mental health. As they move that forward, we know that the capacity or the need is greater than even what 20 beds has, but this is what the systems were able to support and what they were able to put in to help keep them running at a level that is better for the East Metro area.
Mr. Speaker, thank you,
Representative
Representative Schomacker. I missed your point about the 5 short-term beds, so it's still at 20, and I, quite frankly, not expert enough to know what the demand is short-term versus long-term, but at any rate, we're still at the 20. Thank you.
Further discussion? Seeing no further discussion, all those in favor of the motion to concur with the Senate amendment say aye. Aye. Those opposed, nay. The motion prevails. The clerk will give the bill its third reading as amended by Senate.
Third reading, House File Number 3202, as amended by the Senate.
Third reading. Any further discussion? Any further discussion? There being no further discussion, the clerk will take the roll. The clerk will close the roll. There being 124 ayes and 0 nays, the bill is repassed as amended by the Senate and its title agreed to. Messages from the Senate.
Message from the Senate, Mr. Speaker. I hereby announce the Senate has concurred and adopted the report of the Conference Committee on House File Number 3310. The Senate has repassed said bill in accordance with the recommendation and report of the Conference Committee and returned it to the House. The message is signed Cal R. Ludeman, Secretary of the Senate. Conference Committee report on Senate File Number 3310, an act relating to human services. The report is addressed to the Honorable Michelle L. Fischbach, President of the Senate, the Honorable Kurt L. Doudt, Speaker of the House. We, the undersigned conferees for Senate File Number 3310, report that we have agreed upon the items in dispute and recommend as follows. The Conference Committee is signed by 2 of the 3 conferees on the part of the Senate and all 3 conferees on the part of the House. Peterson moves that the report of the Conference Committee on Senate File Number 3310 be adopted and that the bill be repassed as amended by the Conference Committee.
Recognize the author, Representative Peterson, who will explain the report.
Thank you, Mr. Speaker. This is the child care licensing bill that you heard 4 days ago. And the differences that we have in this bill than what you heard 4 days ago is that there's just one provision that we had included that's no longer there, and it has to do with the safe sleep. And so current law will remain for those safe sleep provisions. And I'm happy to answer any questions. All the conferees did sign in this body. Thank you.
Discussion to the Conference Committee report. The member from Hennepin, Representative Flanagan.
Thank you, Mr. Speaker. This is a good bill and folks should support it.
Further discussion to the conference committee report. There being no further discussion, all those in favor of the motion to adopt the conference committee report on Senate File 3310, please signify by saying aye. Those opposed say nay. Motion prevails. Clerk will give the bill its third reading as amended by conference.
Third reading, Senate File number 3310, as amended by conference.
Third reading. Further discussion. Further discussion. The member from Dakota, Representative Peterson.
Thank you, Mr. Speaker. I ask for your support.
Clerk will take the roll. The clerk will close the roll. There being 125 ayes and 0 nays, the bill is repassed as amended by conference and its title agreed to.
Mr. Speaker, point of order.
Representative Gruff will state your point of order.
Mr. Speaker, I've been watching the debate in the Senate, and I rise to a point of order under Article 1, Section 5 of the Minnesota State Constitution. They are clearly in violation of that. I would ask you to take that point of order as well taken.
So noted. Messages from the Senate.
Message from the Senate. Mr. Speaker, I hereby announce that the Senate has concurred in and adopted the report of the Conference Committee on Senate File Number 3656, an act relating to state government. Message is signed Cal R. Ludeman, Secretary of the Senate. Knoblach moves that the report of the The report is addressed to the Honorable Michelle L. Fischbach, President of the Senate, and the Honorable Kurt L. Doudt, Speaker of the House. We, the undersigned conferees for Senate File 3656, report that we've agreed upon the items in dispute and recommend it as follows. And the report is signed by all 5 conferees on behalf of the House and all 5 conferees on the part of the Senate. Knoblach moved that the report of the Conference Committee on Senate File Number 3656 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the author, Representative Knoblach, who will explain the report.
Mr. Speaker, members of the House, Senate File 3656 is the Omnibus Finance Bill. It spends about $76 million this year, primarily on education, health and human services, public safety, and broadband, plus another $58 million on transportation, primarily roads and bridges. Before going briefly through the bill, I want to thank the conferees, Representatives Garofalo, Loon, Torkelson, and Pulowski. These conferees met in public conference committee 8 different times over the last 2 weeks for several hours each time. We had many hours of public meetings over this important bill. And I'm pleased that they are all signers of the conference committee report. I would also like to thank my staff, Harry Kennedy, Gene Coddington, Colby Sullivan, and Bill Glahn, without whom I could not have brought forward this bill this evening. This bill contains a lot of important provisions, but given the hour and given the fact that many people have heard many of these provisions in the omnibus bills when they passed the bill before, I'm going to just list a few of the highlights. In the education area, we have the Safe Schools provision, which is vitally important in providing school districts additional funding to make schools safer, as well as additional funding for mental health initiatives. In addition, there are a number of policy provisions that will improve our schools, such as the establishment of a special education working group needed to recommend ways to better control special education costs. There are also some education provisions in here, policy provisions in here on subjects that were requested by the governor. In the health and human services area, we have several important provisions. This bill eliminates the 7% cut in fiscal year 19, which caregivers of disabled Minnesotans will otherwise face in their compensation. The bill has new provisions to strengthen protections for vulnerable adults, and it also has provisions championed by Representative Baker in combating the scourge of opioids in our state. It also has language fixing an issue that we just learned about a few days ago, which people should be aware of here. About a year ago, the state of Minnesota was notified that they might be in violation of new federal rules dealing with something called Section 340B, which relates to federal reimbursement of medical assistance payments. The state gets about $191 million per year in these federal payments for prescription drugs for people that are on medical assistance. We really knew nothing of this until very recently. About a month ago, according to testimony we got in the conference committee from Acting Commissioner Chuck Johnson just 48 hours ago, about a month ago, the state of Minnesota was informed that they were out of compliance with this rule. The previous efforts they had had over the last year to somehow convince the federal government that they were in compliance were for naught, and they were out of compliance and at risk of losing this $191 million per year. 48 hours ago, we learned in conference committee about this being out of compliance. This is a serious issue, so we have adopted language, or we have language in the bill to deal with this problem. getting us back into compliance with the federal rules, and also providing some additional funding, about $1.5 million, as a bridge to some hospitals that have particularly high-cost medications for medical assistance patients that would otherwise not be covered because of this new federal rule. So that fix is in this particular bill. In the public safety area, we have several important provisions, including increased funding for the guardian ad litems that help abused children. We have Representative O'Neill's mandatory ignition interlock for drunk drivers that have received their second drunk driving offense. And we have increased penalties for those who text while driving. We also join the majority of the states that have eliminated the marital rape shield law, so that a spouse cannot invoke marriage as a defense in cases of sexual assault. There are a lot of other provisions I could highlight, such as the new road and bridge funding for transportation, provisions authored by Representative Garofalo that will reduce the cost of electricity to Minnesotans, increased broadband funding in rural Minnesota, and provisions in the Environment Bill to deal with chronic wasting disease. But in the interest of time, I won't go through an exhaustive list of provisions in this bill, but will instead stand for questions, many of which I probably will choose to defer to the committee chairs who have handled those areas. Thank you for your attention. I now stand for questions.
Discussion to the conference committee report. The minority leader from Hennepin, Representative Hortman.
Thank you, Mr. Speaker. I would move to not adopt the conference committee report.
Hortman moves that the House refuse to adopt the conference committee report on Senate File 3656 and that the bill be returned to the conference committee.
Thank you, Mr. Speaker. To that motion, members, we don't have much time left. We have a little less than 24 hours, but there still is time to get some good work done this session. I think that the approach that was taken at the very end of last session was just to stop negotiating with the governor, close up the bills, and send them to the governor. And last year, that might have been a good strategy because the governor had to sign bills to keep the government operating. Without signing the bills, even though they had many things in them that he did not like, he had to keep the state government functioning and choose between a shutdown or signing some things he disagreed with. That same approach this year does not look like it's going to achieve the same result. The governor doesn't have to take the bad along with the good. And if we would like to save the good work that's been done this legislative session, this conference committee report should go back to the conference committee, broken into pieces, and then we can pass those pieces where we have broad bipartisan support and agreement with the governor and make sure those provisions become law. Many of the provisions that Representative Knoblach spoke about are provisions that those of us on this side of the aisle would also like to see signed into law. There is still time to do this work, so members, I hope you will vote to refuse to adopt the conference committee report, which would, in essence, send it back to the conference committee.
Discussion on the motion to refuse to...
Mr. Speaker, I'd like a roll call.
Roll call being requested, and seeing 15 hands, there will be a roll call. Discussion to the refusal to adopt. Representative Knoblach.
Thank you, Mr. Speaker. Members, I would appreciate a red vote on this motion. In terms of negotiating with the governor a couple days ago, well, actually it was yesterday, just yesterday, gave us a list of 117 items to which he objected to in the bill, either that he wanted deleted, that he wanted different language on, or wanted some other change with. Senator Rosen and I met yesterday. We talked to numerous legislators, talked to the committee chairs, did our best to come up with a way to meet the governor in the middle on that. We actually took 71 of those 117 provisions that the governor objected to and either in some cases deleted them from the bill, or in other cases where the governor was requesting different language, came up with different language to address his concerns. So we have made an effort to compromise with the governor on this. We've met him over 60% of the way. I think that there's a lot of good things in this bill, as Representative Hortman herself has said, and I think that the other suggestion she has of sending this back to conference, breaking the bill up into numerous pieces, bringing that all back here, voting on all those separate bills, frankly, is just not practical. So, members, I'd appreciate your no vote.
Representative Hortman.
Well, thank you, Mr. Speaker. Two important and brief responses. One, the very first day of session, we made a whole big pile of conference committees, one for every topic under the sun. So they're sitting out there ready to spring into action. So it's not unfeasible to take that action. Number two, with regard to the governor getting you some objections yesterday, you know, that could be Representative Knoblach, because the conference committee had not finalized any language until very recently, and didn't finalize the language on the Health and Human Services portion of the conference committee report until late last night. So the governor's lateness in getting information to you really has a lot more to do with your failure to manage the legislative clock than anything on the governor's side of the ledger.
Further discussion? The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, one really good reason among so many reasons to send this back and break it into pieces and do this the right way is because, and I argued this before, but I'm going to say it again, this bill clearly violates the Minnesota Constitution's single subject rule, which is Article 4, Section 17. Members, if this bill doesn't violate this rule, then I don't know what ever would. I've been here now 14 years, and yeah, I was here when our side did a big bill too. And that probably violated the same rule, but this is the most egregious example I have ever seen. And everybody who votes for this is violating your oath of office, because you took an oath of office that said that you were going to uphold the Minnesota Constitution. And you can't pick and choose. And you've been warned. And you know, I heard Representative Knoblach's answer. We've probably gone back and forth on the same thing a couple of times. Well, it just doesn't hold water. You know, you decide that in one instance you think that you have, you're unhappy because you think that the rule's been violated. You go to the court, and the court disagrees. And it says, in this instance, the rule hasn't been violated. That doesn't mean that there is no rule, and now you can just throw out your oath and make a decision that the rule doesn't mean anything. And that is essentially what Representative Knoblach's response has been. Oh, the court doesn't think that my complaint was valid, therefore there is no rule. Well, members, if you think that, I don't know what rule you ever are going to follow. We take an oath, and it's our oath. It's not the court's oath. They take their own. We have the responsibility to act in ways that we believe are legal, are constitutional, not wait for a court to tell us. Sometimes the court does tell us that they think that what we did wasn't right. Okay, there are checks and balances in the system, but that doesn't mean that we give up our own responsibility. So this is an opportunity, before we go any further, whether you like what's in the bill or you don't like it, here's your opportunity to say, I'm going to follow my oath. I'm going to follow what I understand the Minnesota Constitution to be saying, and I'm going to send this back to conference committee so that it can be broken up into separate bills that have at least an arguable chance of being constitutional.
Further discussion. Member from Dakota, Representative Halverson.
Thank you, Mr. Speaker, and I rise in support of the motion to reject this conference committee report. And when I say this conference committee report, thank goodness I work out, because lifting this thing with one hand is a workout. It's 998 pages long. We received it today, and the fact is this is a trust us scenario. Trust us. Trust what we're saying is in this bill. Trust that this bill is not riddled with errors. Trust that we're not sneaking anything past you. And I'm sad to say I have trusted those statements in the past. And last year I voted on a bill that I did not have the time to read, a bill that was given to us with not enough time to digest, to analyze, to discuss. And there were provisions hidden in there that we didn't know were in there. And it was riddled with errors that needed to be corrected. And so my trust is gone. And I stand here hearing what the people of Minnesota have asked us to do this session. And they've asked us to do really important work, and we've committed to them to do this important work, and that's why we get to stand in this chamber and have these discussions. But unfortunately, the important work that we were charged to do has been rolled into this unwieldy mass of legislation, of policy, and of finance, and dropped on our desks with hours to go before the legislative session ends, and we hear, trust us. This is good policy. Well, this is what I know. The people of Minnesota have wanted us to be working together. The people of Minnesota are saying, where is the bipartisan ideas and solutions? And this is what I know. The bipartisan ideas and solutions have been introduced this session. There was so much hope that we were going to hold Big Pharma accountable, and we were going to put resources that we got from Big Pharma, who got Minnesotans hooked on opioids, who started this epidemic of people in our communities, in cities, in suburbs, and in rural Minnesota, addicted to opioids. And we watch Minnesotans dying, and we watch families suffering and be ripped apart. But we're not willing to do anything in this big bill to hold Big Pharma accountable for that. We've got a little watered down proposal in here. And those resources aren't going to be adequate to address the opioid epidemic that the people have asked us to come here to work together to solve. And we've had this terrible issue of abuse of elderly Minnesotans that have been, whose care we have been charged with overseeing. And we had some really smart people come together and say, this is what you need to do. We need action, and instead we're going to choose to study the problem a little bit more, instead of relying on all these outside experts who say, here's some really important action you can take. And we had families coming to us this year and saying, we don't want to see our loved ones dying because people are talking on their phones and fumbling with their phones, and law enforcement said, the laws that you have in place for distracted driving are inadequate to save lives. They're inadequate for us as law enforcement to actually even enforce. And so they called on us and they said, pass a law where we use hands-free technology in our vehicles. Let's save some lives. Today I was driving home when we were on break, and I saw a semi-truck that had driven into an overpass in my community. And what's the first thing you think when you see an accident like that? Was that driver distracted? We had a fatality on Highway 36 where a distracted driver killed somebody. Do you think that people shouldn't be coming home from work because we were too partisan to act? There is tremendous agreement on the need for this. And our communities are crying out for this, and it's not here. 989 pages, and we can't do it. School safety has been on our minds. I started the session by getting to meet the kids from Parkland, Florida, who weeks after being shot at came to Minnesota to celebrate their hockey tournament and come to Minnesota to play hockey. They found our spring a bit cold, but they found our hospitality warm, and they shared with me what they were thinking and feeling and what they were asking of us. And watching them interact with citizens in our community and citizens in Minnesota, watching them connect with teachers from Red Lake or Cold Spring who had also lost students and lost loved ones in school shootings in Minnesota. And then we get to bookend this session with the news out of Santa Fe, Texas. And there is nothing in this bill that is going to adequately respond to what the citizens have asked us for with regard to keeping our students safe at school. And do you remember the good old days when school shootings would happen and people would say, boy, I never thought that could happen in my community? The soundbite coming out of Texas yesterday was a child who said, I've been waiting for this day to come. It happens so often, I figured it would happen here. I never want my kid to feel that way. Our citizens have cried out for us to take action, and we've got 998 pages saying, I guess we can't. And we've got workers in long-term health care who have been crying out. And we've got citizens living with disabilities who have been crying out and saying, I don't have somebody to get me up every morning. I don't know if my care worker is going to show up. I can't find somebody to work for me. Please help us with this wage issue. Please help us with resources. And we have yet to respond. This bill does not respond. This is stuff we agree on. This is stuff we agree on. These are important values for the state of Minnesota. This is what our citizens are asking us for. And we have a 998-page bill that we're told what it does. But even if it does everything that you say it's going to do, none of the things that these folks have been asking us for are in here. And none of the things that we've come to agreement on in a bipartisan manner are in here. People are asking us to solve real problems in their lives, address the gun violence crisis, make sure that we're caring for our elders, make sure we're funding our schools and keeping them safe. And we are not answering. And we're not delivering solutions in a responsible manner. So send this bill back. We don't have much time, but I don't know about you guys. I'm ready. I'm ready to camp. I got all my gear. I got snacks. I can be here all night. I can be here till midnight tomorrow. Let's do the work. Let's send this back and get the work done. Thank you.
The member from Blue Earth, Representative Considine.
Thank you, Mr. Speaker. The last day of the 2016 session, I stood up and said, it is a disgrace what the PCAs and the home health aides get paid for in the state of Minnesota, and we need to do something. They're at 40% of the poverty level. Last year, I got up again and said it, and we had it in the Health and Human Services Finance Committee twice. Once Representative Hamilton's bill, once mine, and both times it was voted down. There were 8,000 positions that were going unfilled. We heard a horror story of a woman whose PCA quit in the middle of a shift, and she was in bed and she couldn't get out. And the only thing that saved her was somebody else let her next shift in the apartment. Otherwise, she would have starved to death in bed. Now we're up to 9,000 open positions for the people that take care of the developmentally disabled and are mentally ill. And they can't feed their own children. They're on food stamps, and yet it's not in the bill, and you're still not moving on it. We heard the bill again this year in committee, and we're still not doing anything. This is an embarrassment to the state. It's disgraceful. These are our most vulnerable citizens, and we're not doing anything. I see half of you looking down at your desks. You should be ashamed. These folks count on us, and we're not doing anything about it. They haven't had a raise. They can do better at McDonald's. And it's gotten to a point where people won't even bother to apply for the jobs. And it's not in the bill. We're not raising their wages again. What's it going to take? Yeah, I'm a no on the vote.
The member from St. Louis, Representative Olson.
Thank you, Mr. Speaker. In regards to refusing to adopt, I also rise to support this motion because from the beginning of session, from before the time we even got here, we knew we had some big problems we had to tackle. And we knew we could do it together in a bipartisan fashion, and that was around elder care and opioids. And so came into session hopeful and had a set of recommendations put in front of us by a consumer work group. And you have a letter on your desk, or that's getting passed out, from the group that was charged with, put together by the governor's task force to put together a set of recommendations for this legislature. And this is an incredibly strongly worded letter by the people most impacted by this issue, saying we are not doing enough. And not only are we not doing enough, but we have somehow made it worse since this bill originally left the floor. We need to do more and we need to do better. So we have AARP, the Alzheimer's Association, Elder Voice, Legal Aid, the Minnesota Elder Justice saying we need to keep working. So this isn't a time to tuck our most vulnerable, our elders, the people that most need us to stand up for them, in a 900+ bill. We've had time to do a lot of other standalone bills on this House floor. How have we not been able to do the work of this? How have we somehow managed to make this worse? In fact, one of the things that the majority party has talked about fixing and doing a lot with is the Office of Facilities Health Complaints. Well, the language in the bill in front of you would actually make it worse. I don't know if this was just incompetence or intentional malice, but what happens in this bill is it will actually make it no longer financially viable to run that program. That they would have to continue to just use the money on a case management system, not be able to send the investigators out to do the work to investigate the 400 complaints we are getting a week. 400. So not only have we made it worse for the place that's supposed to investigate, we have fallen woefully short in any of the protections our elders need. And I encourage you to read this document in front of you in case someone says we're taking care of our elders in this bill and you buy that and you believe it and you think that we're doing it. Read this. Come talk to me, come talk to others, send this bill back so that it can get the work it needs to. We're not putting forth anything that would help with licensure. We currently are a state that doesn't license assisted living. We are not giving the private right of action, so we may put some good things in there around deceptive marketing or whatnot, but there's no way to enforce it. 400 complaints a week. 400 complaints a week. And this couldn't be a standalone bill. You have to wonder why. You have to wonder why we can't have a standalone bill on elders. So for this, I want this bill to go back. I want it to get worked on, whether it comes back better in this way or we could break it apart and give it the time it needs and deserves so that we can debate this bill. We can have a good conversation around the protections our elders and our vulnerable need. Because it falls short. It falls really short. and it doesn't do what we need to protect our elders. So I urge the Republican majority to get serious about protecting our elders and our vulnerable. And furthermore, when we say, I wonder why things aren't broken up, it's hard to even begin to think how we fell short in the opioid epidemic as well, the opioid crisis. How the Republican majority bent to the interests outside this chamber. This runs deep. This crisis is impacting my community, my life, people I care about, people I love. And somehow the Republican majority has bent to a special interest that's willing to profit off of the suffering. This is really disheartening. And I wish we could have the courage to debate a standalone bill around opioids, not tucked into a 900-page bill. That we could have the conversations we need to have. So for that, I ask for support of the motion to refuse to adopt so that we can do the work we need to in these two areas in particular.
The member from Hennepin, Representative Hillstrom.
Thank you, Mr. Speaker and members. Members, I too urge you to send this conference committee report back. Members, if you look at the public safety bill that we passed off this floor, it previously passed in a bipartisan fashion. But this bill does not take care of the needs of Minnesotans when it comes to public safety. The increased penalty for people who repeatedly buy sex was removed from the bill. That was a Representative Ward bill. Penalties for depiction of child sex abuse sections were removed from this bill. Enhanced penalties for folks who repeatedly commit theft, Representative Anderson's provision was removed from this bill. And the pieces about administrative and discipline segregation at the Department of Corrections, which was a Representative Zerwas bill, was removed from this bill. Now, there's discussion about how there's some money in here for the Guardian Ad Litem Board. But when the bill left here, it was fully funded. And now it comes back woefully inadequate. Members, it started off in the first year, we had $3,667,000. Now in the first section, we have $2,940,000. But in the out years, it's less than half. That is a problem if you want to take care of our most vulnerable children. We have a problem with the health care contract in the Department of Corrections. It's a constitutionally mandated that we provide health care to inmates while they are in our correctional facilities. Originally, the Department of Corrections had that contract at over $10 million. They renegotiated and they got it down to $7.8 million. This is only funded at 6.6 and in the tails 5.1. That is a constitutionally mandated health care. This violates that. So members, we can do better and we must do better. We've talked a lot about opioids. The folks who are released from our prison are most likely to overdose. Right after they're released from jail or right after they're released from prison, that is the time that they are most in danger. And there were programs proposed by the Department of Corrections to take care of that issue. And we failed to fund it here in this bill. I should say you failed to fund this in this bill. Hands-free driving is not in the bill. We know that that saves life. I would urge you to send this bill back.
The member from Hennepin, Representative Dabney.
Thank you, Mr. Speaker. Representative Schomacker, are you still on the floor? I can't. Well, perhaps he can hear me. Who knows? I wanted to start, Mr. Speaker, on congratulating Representative Schomacker on doing an increasingly rare thing. The bill we just passed tonight for regions was actually a very good example of the legislative process working, of compromise, of different stakeholders in the community, in this case, different health systems, wrestling it out, different members having different perspectives and point of views, and he got to a bill with 124 yes votes off the floor. It had fewer mental health beds than I wanted, but it had some. It had more than probably some people wanted, and there was, I'm sure, some other things that different members felt differently about. But it was a standalone bill that worked its way through the process with an active author and a compromise achieved and a bill passed off the floor. Those of you who grew up and can, in the 80s maybe, and can still hum along with, I'm just a bill on Capitol Hill, that's the way you were taught it worked. Representative Erdahl has got some civics language in the bill. That's what we're going to teach the kids about how it works. I've taught that. But members in Minnesota, that's not the way it works anymore in the Minnesota House of Representatives with the current leadership. Minnesotans wanted us to do something about the opioid crisis this year. And there's broad bipartisan support and broad public support for us to do that. A standalone bill that worked its way through the process, that heard the voices of Minnesotans, that heard the voices of members of this body about the tragedy of opioid addiction and death. But the leadership of this body said no. We can't work a standalone bill with broad public support through this legislature. They wanted us to do something about cell phones and driving. They wanted to be safer on the roads. They heard from law enforcement. Actually, they heard from the widow of law enforcement, of an officer killed by a distracted driver, pleading that we take the action with a standalone bill with bipartisan support and broad public support and do something to make our roads safer. But the leadership of this body said no. Elder care. There's a crisis. It's been on the front page of the paper. People are horrified. They're seeing our vulnerable elderly abused in care settings. Broad bipartisan support, broad public support, a standalone bill working its way through the system of this legislature would have passed off the floor, but the leadership said no. And then the topic you don't want to hear about, safe schools. Representative Halverson did an excellent job of talking of the bookends of this legislative session. Those bookends being 17 dead in Parkland, Florida, and 10 dead in Santa Fe, Texas. And yet, this bill that we're being asked to adopt cut funding for safe schools from the bill that left the floor. I know you don't want to hear about it, but Mr. Speaker, guess what? Minnesota isn't watching. It's after 1 in the morning when you bring this bill up. I don't blame you. If this was my bill, I'd wait until at least 1 in the morning to bring it up. If I had to take responsibility for cuts to safe schools funding from the original bill, to being unwilling to step up to make schools safer, unwilling to step up to work with the kids who need it, unwilling to step up to make sure there's social workers and counselors and nurses available in schools because that's what kids need, I'd do it at 1 in the morning too. But that's another bill with broad bipartisan support, broad public support, that could have worked its way through the system to a standalone bill like the governor asked for and promised to sign, but the leadership said no. Representative Schomacker, I don't know what you did to convince your leadership that one hospital system in one city in the state of Minnesota was important enough to actually have the legislative process work the way we teach kids in school it's supposed to work, the way our constituents expect it to work. But congratulations, Representative Schomacker. Maybe you should be the leadership, because the current Republican leadership are doing a disservice to the people of Minnesota when they put everything in one bill and are unwilling to step up and serve the people of Minnesota on the issues that they care about and that we all can agree on. I urge a yes vote on the Hortman motion to refuse to adopt. Thank you.
The member from Dakota, Representative May Quaid.
Thank you, Mr. Speaker. Members, I'm genuinely concerned. Republicans, I'm very concerned because I'm wondering how many of you can hear the literal pleas of Minnesotans who are hurting, who are being abused, who are vulnerable, who are dying. They have marched and walked and called and wrote and sat in and stood up and walked out and nothing. It's devastating. But it's terrifying. What is happening to an accountable and accessible democracy when a policy supported by 90% of Minnesotans cannot get a vote on this floor? When a policy supported by 79% of Minnesotans, hands-free driving, cannot get a vote on this floor? What is happening? I spend every single Friday, with the exception of yesterday or 2 days ago, I don't know what day it is anymore, in the schools in my district. Every single teacher, and the students, if they're old enough to know, asks for the same things: more counselors, more resources, more time to learn and free play, not more testing, not less funding, not less activities, certainly not bigger class sizes. And yet, when the governor and these districts are asking for emergency funding to cover huge gaps, $12 million alone in my district, nothing. These are the youngest and brightest minds of our state. They will be the people who will take care of us one day. And we're cutting them off at the knees. That is devastating. Republicans, I need you to hear the people of Minnesota, because what has happened is that policies that should be driven by people and not partisanship have been met with partisanship, not action. They have come to this Capitol and said, we are vulnerable adults. We are adults with disabilities. It is intimate care what happens with PCAs. And yet we pay them so little, they don't stick around for very long, and every other week someone new is helping me get dressed. How would you feel about that? Every other week, a brand new person shows up to your house to help you get dressed, or to help you eat, or get around. We pay them so little that they leave and work at Aldi, or McDonald's, or Target, where they can get paid more so they can feed their families. And there is nothing in these 998 pages that addresses that. That is devastating. These are Minnesotans who are pleading for our action, for your action, because you are in the majority, you are in charge. And it is 1:10 in the morning, the day before session ends, and we have 998 pages of nothing. Nothing that Minnesotans have asked for. Devastating. This bill, this whatever this is, must go back to conference committee and be broken up and do more for Minnesotans because they have pled, thank you, this bill. They have pled, they have come here, they have told their stories, they have written to you, they have stood on the steps with the faces of their loved ones who have died, they have told the media. I don't know what else they need to do to get you to listen. We must do more. You must do more for the Minnesotans in this state. They are asking you to do it. So I rise in support of this motion. We have to do our job better. Please support the motion.
The member from Washington, Representative Ward.
Thank you, Mr. Speaker. My colleagues have covered many of the issues that we've been hearing about. And I'm sure that your constituents, like mine, have been writing and calling every day. And the list is very consistent. The opioid crisis, elder care, cell phones, safe schools, proper funding for schools, guns, sensible gun protections for our children, for our families, for all public spaces. One thing we haven't talked much about is cybersecurity. Cutting the budgets of the agencies that carry all of our information, a lot of private information that's needed, but is very vulnerable to the attacks, the very sophisticated attacks that are coming every day. And we are cutting the funding to be sure that we have those protections. The only other thing that people say very consistently is do your job. And they're watching, maybe not at this hour, but they are listening to what is happening here. And they're recognizing that you, because you're in charge, are not getting the job done. I urge you to support the motion.
The member from Hennepin, Representative Carlson L.
Yes, Mr. Speaker, I've got a couple of short questions. My colleagues have covered the bill well, but Representative Knoblach, yield for a question.
He will yield. Representative Carlson.
Representative Knoblach, you indicated in your presentation that a number of issues had been dropped out of the bill, but you didn't say anything one way or the other as to any new issues that may have been added to the bill. And as you know, our rules provide that anything that would be added to the bill would have had to pass one body or the other. And with a bill that's almost 1,000 pages long, it's a little difficult in a short evening to go through and identify any new issues that could have conceivably been added that hadn't passed one body or the other. So if you could answer that question, Representative Knoblach.
The member from Sherburne, Representative Knoblach.
Mr. Speaker, Representative Carlson, if you're speaking, Representative Carlson, of, I was referencing the governor coming forward with a list of changes that he wanted, 117 changes, none of them related to adding anything to the bill, and so there was nothing added in response to the governor. All of his changes were requests for either different language on a subject already in the bill or a deletion of something in the bill.
Representative Carlson.
Mr. Speaker, Representative Knoblach, yield again for a question.
He will continue to yield.
There are other ways that new language can be inserted in the bill, and you responded from the governor's perspective, but you had 10 conferees, and I'm sure you were visiting with other legislators, so were there any new issues, regardless of source, added to the bill?
Representative Knoblach.
Mr. Speaker, Representative Carlson, I'm sorry, when you asked me before, I thought, the context was speaking of the governor and what he had requested. Otherwise, in terms of a new issue, I don't know that there are any new issues that were added other than there's already language in the bill relating to prescriptions. There's language, lots of language in the bill related to the medical assistance program. There's language in the bill relating to the federal government and its reimbursement to the state for the medical assistance program. I did speak of this 340B federal rule that we very, very recently learned the state had been told we were in violation of, and so we did take language to correct that so the state would not lose $191 million of federal aid. That was an issue we didn't know about at the time that the bill passed the House, but there is language relating to funding prescriptions, to dealing with medical assistance, to dealing with related subjects that did pass the House, and so we did pass related language to that in the bill. But I guess off the top of my head, I can't think of any other new language in the bill.
Yeah, and Mr. Chairman,
Carlson.
or Mr. Speaker, Representative Knoblach, you did identify that one, but I was wondering if there were any other additional new issues, and you are indicating there are no other new issues that were inserted. An area, if Representative Knoblach could yield to another question that, I've been concerned about in our discussions in Ways and Means and you and I one-on-one, and that's the question of tails. You did talk about the spending in the bill at $76 million, and what are the tails in the bill? What did they total?
Representative Knoblach.
Mr. Speaker, Representative Carlson, $72 million.
Representative Carlson.
Mr. Speaker, Representative Knoblach, how did that compare to the cumulative tails numbers? The numbers you gave me were by subject area, and I haven't calculated what the total tails were, but the cumulative number, were you within your tails?
Representative Knoblach.
Well, Mr. Speaker, Representative Carlson, of course, when you talk about being within our tails, as you know, when you pass a bill off the House floor, we've got our regular target for the fiscal period that we're in. We've also got tails, which isn't a target that's required to be adopted under House rule, but we have, tails targets that we set for chairs anyway. But once you go to conference and you are negotiating with the Senate, you start over and you don't adopt targets on the House floor. You have a whole new set of negotiations and a whole new set of targets. So, what we spent in tails, or what we're proposing to spend in tails for 2020-21 in the conference report, really doesn't have that much to do with what we passed off the House floor. However, in total, I will tell you that the tails, the proposed spending for 2021 that is in the conference committee report, is somewhat less than the proposed spending in 2021 for what passed off the House floor.
Yeah, and Mr. Speaker, Representative Knoblach, I know full well the difference between the tails that we would have relative to the House bill, but then the conference committee is also negotiating both the spending level and the tails for the conference committee. And when you and I were talking about tails, I assumed that we were referring to the tails that had been agreed to within the conference committee. And did you end up within the conference committee tails? Because that's the bill that's before us here tonight.
Representative Knoblach.
Mr. Speaker, Representative Carlson, yes.
Okay. Thank you. The reason I was asking, especially about new issues, the motion before us is to return this bill to a conference committee, and I did have some concern because of the sheer size of the bill that there could possibly be some new issues. But I do want to comment a bit in support of the motion. And as some of the members that have been here for a few terms know, that I have been down the road of carrying an omnibus bill, but my goodness, never, Mr. Speaker, a bill of this magnitude or size or with this number of policy issues included. When we begin to approach 1,000 pages and we have a 1,000-page bill on the House floor the last night, that's just truly not manageable. The questions that I was asking about whether there were new issues, there was no way this evening that I could go through that bill. I had to rely on the testimony here on the House floor. But to go through a bill of 1,000 pages and try to identify whether there were new issues or not, or quite frankly, to even calculate the tails, which is an important issue. Members have heard me speak to that issue before, because I do have concerns about the projections through the Council of Economic Advisors about what our future growth is going to be, and that's why a discussion of tails is vitally important. And so, members, I would encourage support of returning this bill to the conference committee, and I would suggest that you follow the advice of the minority leader. There were several bills that were sent off the House floor. At the time, I viewed them as potential vehicles. I think they could be used to break this bill up, have it more manageable, and quite frankly, for members on both sides of the aisle to have a better understanding of what this bill contains.
The member from Hennepin, Representative Wagenius.
Thank you, Mr. Speaker. My colleagues have been talking about breaking the trust with Minnesotans. That's the consistent pattern in this bill, and that pattern continues in the energy article. The Minnesota Department of Commerce has been consistent in opposing the Republican plan to break the agreement between Xcel and the people of Minnesota. Minnesotans agreed to allow storage of nuclear waste in Minnesota in exchange for dollars from Xcel that would be used to develop renewable energy. Now, in an effort to put the brakes on renewable energy, Republicans want to reduce the money owed, no matter how many casts there are now and how many will be in Minnesota in the future. And since Xcel is adding more casks and plans to operate the facilities until their end of their license, then this is a double whammy. The breaking of the agreement is a double loss for renewable energy. So instead of breaking this agreement and breaking trust with Minnesotans, we should be expanding renewable energy, like using renewable energy on the rooftops of our schools. The bill takes another shot at circumventing the Public Utilities Commission, and the Department of Commerce has been consistent in insisting that the utilities not circumvent the PUC. Specifically, there is a proposal to circumvent with regard to pensions, and what the public utilities wants, what the PUC should be doing is making sure that ratepayers are protecting a guaranteed rate of return on assets. The department wants to protect Minnesota workers and Minnesota consumers and wants to make sure that prepaid pension assets are treated uniformly for all utilities. The third thing I want to bring up in this energy article is this last-minute amendment that was not introduced in a bill, was not heard in a committee. It's a deletion of one word, the word financing, in the Community Solar Garden Statute. Removing this one word prohibits the Public Utilities Commission from approving rates for community solar developers that would allow them to finance projects. and it stops the efforts to help low-income Minnesotans share in the benefits of solar. The Department of Commerce opposes deleting the word financing. They are so right. Good for them, and another good reason for refusing to concur.
The member from Hennepin, Representative Joachim.
Thank you, Mr. Speaker. You know, we've had all session to do the work for Minnesotans here, and here we are again playing beat the clock. And, you know, you might hear a lot of frustration from our side of the aisle because we're not in charge. And the GOP's answer to all this work we've done is to cram everything into a 980-page bill and say take it or leave it. Because here we are, under 23 hours left. And this 980-page bill, I kind of feel like I'm playing Where's Waldo with my kids, trying to find where the voice of Minnesota is here in this bill. Not finding it. And, you know, my colleagues have been very eloquent about what's missing. You know, we're missing holding Big Pharma accountable for the opioid epidemic. We're missing any substantial elder abuse reform, just working groups. No new money during this time of surplus, no new money for cybersecurity for all of our agencies. And one of the biggest disappointments is not addressing the desperate need our schools have for more funding for their shortfalls, especially when it comes to special ed cross subsidy. And I want to thank the governor for his emergency funding request, because that is the #1 thing I've heard from my school districts. And not just this year, but last year, and the year before, and the year before that, because I've been advocating for education funding. I started out 15 years ago doing that, and we were talking about it back then. And it was slowly growing, but in the last few years it has snowballed to something that is really hurting our districts. You know, I did see your proposal earlier today on Twitter about the new money you're going to put in education. And wow, it's just a bunch of shifts and gimmicks. It's money that's already allocated to the schools. And you're just saying, hey, we're just going to give you the flexibility to decide which holes you're going to plug. But man, they have a lot of holes. And the decisions they're going to have to make aren't going to get any prettier with this bill. So I would say with this just under 23 hours that we have left, that I'm begging, imploring GOP leadership, because this is your choice and you're in charge, to not send this to the governor and say take it or leave it. Let's take the time to actually get this done. And I actually hope that a few of my colleagues across the aisle will join us on this vote and send this bill back.
The member from Ramsey, Representative Mahoney.
Well, Mr. Speaker, I don't have anything, you know, I spend a lot of time on economic development, and that's really where I focus most of the major parts of my energy. So I don't really have any of you know, after listening to people talk about elder abuse, the failure to take care of our senior citizens, and the opioid problem. I don't think it's a secret that I've been clean and sober for 38 years. And to see the new kids coming into the AA meetings that I go to is heart-wrenching. Heart-wrenching. And we are letting Big Pharma, who hired dozens of lobbyists to come in here and defeat a good bill to protect their financial interests. I don't have anything quite that dramatic in my comments. Or school safety. think it's already been said, I think it's 27 children have been killed this month. Children, kids, our future, people that could have been sitting in these kind of chairs in the future. That which I have to talk about isn't really that dramatic. What I'm going to talk about is $15 million for broadband. It's wholly inadequate. These cities they're not cities, they're townships. They're people that live at the end of the road, that are trying to craft a living or educate their kids. And we're going to do 5,000 households this year with this $15 million. And we should be doing 11,000, which is what the governor wanted to do in his bill. The other piece, we're not going to do child care startups. We took that money. One of the most important issues, if you talk to rural business people and women with children, in greater Minnesota, one of the biggest issues out there is child care. That's keeping hundreds and thousands of parents from going to work. And I will give credit to Representative Baker. He had a good bill, and we cut that funding. BDPI, strange alphabetical letters, but those help all those small towns out in greater Minnesota because it's basically greater Minnesota business development. It helps small towns cut the do a curb cut for a business. Maybe do a little bridge loan. Not even a big bridge loan, just the $10,000 bridge loan for these small businesses that are starting up in greater Minnesota. But here's what I'm going to finish real quick here because it's 1:30 and we should all go home and rest. But I'm going to be more upset about 750 young people, young families, young men and women trying to stay out of trouble and become responsible, good citizens. We're going to take away, in this bill, the ability for 600 first-time homebuyer grants. And it doesn't even cost the state a dime. We're taking that money away to build middle-class apartment buildings. Basically, that's what we're going to do. We're going to take college kids that have thousands and thousands of dollars worth of debt, and they're trying to get into their first home and build wealth. And we're taking that away, those 600 kids, families. And then there's 100 to 150 young men and women in inner city areas that we are not funding. We took them, it was in our bill as it went to conference, helps these young men and women get a mentor that helps them find jobs, stay in the job. These mentors help tell them that you got to show up at 8 o'clock in the morning or 3 o'clock when you're with your part-time job. You got a problem with your mom or your dad. Come on and talk to me about it. Don't get mad at your mom and dad. Don't stomp off and hang out with the other teenagers that are going to try and get you in trouble. It's called the Ambassador Program. It's one of the most successful programs for young people. We had police chiefs, we had police officers, we had school counselors, we had community leaders coming and telling us this is their priority to help these 100, 150, 200 kids. So I don't have the gratitude, the big issue, the failure on elder abuse, the failure on opioids, the failure on school safety. My concern is for less than 800 young men and women trying to get ahead in this world. And we're not going to help them. And I think the only cost was about $150,000 or $200,000. It wasn't much. Because the $600, 600 home buyers, that's money the state already has and uses it for that. And you took it away from the Minnesota Housing Finance Agency. Or you moved it, you required them to move it. And the ambassadors program, that was cheap. That was cheap. That helps those kids get a high school diploma, maybe go on to get a certification, realize that they could actually make a living, stay out of trouble, raise a family, be good U.S. citizens. Members, this is not a bill to be proud of, even if it weighs more than any bill I've ever seen in my long career here. You know, I remember a member in the past that grabbed that bill and he threw it up in the air. Some of you may remember it. I don't think I can, I'm not sure I can lift and move it that fast to get it up into the air. So with all that paper and all that failure, return this bill.
The member from Hennepin, Representative Clark.
Thank you, Mr. Speaker. Members, I'm asking a document to be passed out to you. It has a photo of a little child, just the one with the photo. Because I don't want to give up on you. I want this bill to go back so we can have a chance to do a couple of things, but I'm going to focus on one thing. And I'm wondering, I don't see either Representative Dean or Representative Schomacker here. I'd like to ask them a question. Maybe they would come back to the floor. It's a question dealing with the fact that we have hundreds and hundreds of children, mostly toddlers, starting with toddlers, who have severe brain damage every year because of childhood lead poisoning. And some of you maybe get tired of me bringing this issue up because I've been bringing it up ever since I've been here, which is a pretty long time. But we have made very little progress in dealing with this issue. Years ago, when lead was added to paint and lead was added to gasoline, there was a big fight in this country. It was a fight with the public health agencies who brought up this issue and said, lead is a toxin, it's a hazard, it should not go into consumer products. This happened at the federal level in the 20s and 30s, and the public health folks lost, and the industries won. And so now we have been living for decades, generations really, with the lead that's in our soil and the lead that's in our paint, in our homes. And I just know that we can do better than what we've been doing. And I wanted to ask Representative Dean a question. I guess he still hasn't come back on the floor. But both Representative Dean and Representative Schomacker were individuals that I asked many times 4 years ago, and then again 2 years ago. I introduced legislation, House File 491. If you look on the date on that, that's the bill for this biennium. It was January 26, 2017. And I asked numerous times, can we please have a hearing on this bill so we can talk about the fact that hundreds and hundreds, actually 800 and some children in 2016 are seriously lead poisoned. Again, this is a toddler's disease, and this doesn't even count the pregnant women whose fetuses are poisoned by their exposure during pregnancy, because it's a very vulnerable time for that kind of exposure to lead dust. And I never got a hearing. This year, I came back again, and this is the last time I can bring this issue up to you, and that's why I don't want to quite give up on you. I want you to send this bill back and put it in one of those conference committee bills that you devise that would fit, and Representative Knoblach, I know you'd know where to put that. And what I'd like to ask you to do is consult with Representative Garofalo, because he's been very helpful on this. He's the only one on the Republican side over there who's actually taken this seriously, and I want to say thank you for that, both last year and this year. But it's not in this bill. It came out, and Representative Garofalo, since our other colleagues aren't here, maybe I could ask you to stand and help me understand. Would you yield to a question?
He will yield. Representative Clark.
Thank you, Representative Garofalo. You're not the one who deserves to get this question right now, but I have to ask you. So why did the bill that would have helped us and helped people who are renters and homeowners and landlords, that would have helped them be able to know if they had toxic lead in their properties. Why did that appropriation to help them do that, why did that come out of this conference committee report?
The member from Dakota, Representative Garofalo.
Mr. Speaker, Representative Clark, there was a strong consensus in the House side that we would be much better off using funds for your program for lead abatement than to use subsidies for job creators. Right now, the state has a 3.2% unemployment rate. We don't have a lot of people coming to us saying they need to create more jobs. We have people saying we need things like workforce training and workforce development. And so we took that money that was going directly to employers to subsidize job creation, and we put it into a menu of programs. One of them was the lead abatement program you referenced. Some local units of government and some business interests were opposed to that, as was the Senate. And in conference committee, I was not successful in prevailing the House position that that would be a much better use of those funds than having those be subsidies for job creators.
Representative Clark.
So Mr. Chairman and Representative Garofalo, you and others who are in the Republican leadership are putting yourself in a position where you're choosing between worthy causes. It's kind of the Sophie's choice. There's no good choice. But I have to say that the document that you have passed around, and I again want to give you credit for putting it in the bill in the first place. But we talk about what this costs. So those people who are in jobs, or if we were able to give them job training, if they have a child who's lead poisoned in their property, and if they get sued, it can cost them as much as $100,000 per year, because that's what we know the cost can be for these little children when we're talking about special education that's needed, the kind of help they need from medical care. We named this particular bill after a young man who, I just want to briefly tell you his story, because we never got to have a hearing on this. There's no hearing for us to even all become more stronger advocates. Young man named Dustin Luke Shields, and his mother is fine with us sharing his name because she wanted this to be created in his honor. And what it would have done would have been to help people know, property owners, landlords, and others know whether or not they were creating this problem and causing little children to be lead poisoned. And I do want to say this, there was agreement with the landlords on this bill. Mr. Chairman and Mr. Speaker, there was agreement, and I don't have a paper with me today, but we know that, and I would have liked that to have been in testimony in the Health Committee. I would have liked it to have been testimony in the Tax Committee. I also did not get a hearing on the tax credit that we wanted to offer to landlords and property owners in the Tax Committee from Representative David. So, like I said, I don't want to give up on you all. I really would ask that we could take this bill back, and this would be one of the issues that we would look at. Please just look at the information that's passed out here. This is not just an inner city issue, although what I can tell you is this is more of a poor people's issue all over the state. There are a number of counties in our state that have more than 50%, higher than 50% incidence of childhood lead poisoning, and it's in this document. You can look at it. Certainly the counties of Hennepin and Ramsey, but also the counties of Faribault, Freeborn, Lacaparo, Mower County. These are counties all over because we have housing that's old, we have plumbing that's old. One of the things that has become more and more apparent to people, but we don't have the information on it because property owners don't have the resources necessarily to check it and fix it, is that a lot of our plumbing is either with old lead pipes or even just the solder that's used between pipes until a number of years ago was lead. So this is a source of permanent brain damage for little children, and I can't see this bill go by without bringing it up again and asking you to please consider it. We have something like 359,000 renter-occupied units with these potential lead hazards all over our state. So this is something for all of us. This is something we all need, and we especially need it for, again, our little toddlers. So Mr. Chairman, I really hope that members will vote to send this bill back so that we can actually do what needs to be done. Thank you.
The member from Hennepin, Representative Pepin.
Thank you, Mr. Speaker and members. Members, I'm asking you to vote red to this motion to refuse to adopt, and I have to thank Chair Knoblach and the members of the conference committee for all the work they've done. And we've heard some tonight about folks feeling like there wasn't some thought put into this bill, but I have to tell you, this conference committee had 8 hearings with over a dozen hours of testimony during the last 2 weeks. And the bills that they heard were all heard on the House floor. So there was an awful lot of work. You did a great job. I want to talk a little bit about some of the discussions we've had with the negotiations. You heard the governor say that we haven't been working with them. I think Chair Knoblach might have mentioned this, but the governor brought to Chair Knoblach and the committee something like 116 concerns. Some things he wanted deleted, some things that he wanted language modified. And the committee was swiftly able to address more than 70 of those concerns. 70 of the 116 concerns of things that were important to members of the legislature, things that were important to this body or important to the many members who serve in the Senate. We met the governor more than halfway, much more than halfway, more than 60% of the way, even though the House and the Senate felt very, very strongly about those provisions. But because the governor had concerns, and because we know the things that are in the bill are very important to Minnesotans, we're willing to make those compromises. One of the things in the bill is school funding. We've talked a lot about safe school funding. And members, some people on the other side complained about schools not getting enough funding and needing emergency funding, and I think that we'll look at that tomorrow. We have another bill coming tomorrow. But I want you to consider what we've already put in schools this biennium. This biennium, we put in almost $500 million of new dollars for school funding. This biennium. This is supposed to be a supplemental bill. We gave them that last year, the largest formula increase in more than 10 years. And in fact, schools have gotten billions with a B over the last few bienniums. But we understand there's a problem, and we agree. We agree with you that we need to make sure that we address safe school funding, and that's why we're putting $28 million into safe school funding for things like mental health counselors, things like school resource officers. They can use those dollars for facility upgrades. And I think you'll see when we do the bonding bill tomorrow, there'll be additional dollars for safe school funding. So if you vote against this bill today, though, you're going to vote against $28 million in safe school funding. So I want you to think long and hard before you vote on this bill. And I hope you vote red right now and then you vote green later when we vote on the actual funding in the bill. The bill also has $57 million in road and bridges, $16 million to fight opioid abuse. So many of us have talked about that. I know Representative Baker has spoken on this issue many times, I think all across the country. So if you vote against this bill today, you're voting against more than $16 million to fight opioid abuse. This bill also has a comprehensive package for vulnerable adults that focuses on transparency, prevention, and accountability. Additionally, this bill restores the 7% cut for employees who care for the disabled. And I, for one, don't want to vote against that. I, for one, and I hope our side at least thinks that that's an important thing to fund. And if you think that's a crisis too, then I hope you'll vote for this bill later on. This bill also, despite what many of you said, increases penalties on texting and driving. Several of you said that it didn't. This bill triples the fine for distracted driving, triples it. So if you vote against this bill today, you said it was a priority, you tried to suspend the rules the other day, this bill triples the fines for that. This bill, it cracks down on dangerous sex offenders, including the frightening bus driver background check loophole. Do you want to vote against that? Think about that long and hard, because I don't think it's a good idea to vote against that if you really care about our kids. This bill has $15 million in broadband funding. For you rural members, I hope you think that's important, because if you don't, if you vote against this and the bill goes down, your areas are not going to get that broadband funding. This bill helps secure cybersecurity in our state government. So if you have concerns about cybersecurity, cyber attacks, then I don't think you should vote against the bill. This bill has nearly $7 million in increased funding for additional guardians ad litem for children who are desperately in need of protection. Do you want to vote against that? Do you want to go back to the citizens of Minnesota and say that you voted against it? I wouldn't recommend it, and that's why I'm voting for this bill. This bill has something that's very important to the Secretary of State. $1.5 million for the Secretary of State election security. Do you want to go back to your citizens and the constituent you represent and tell them that you didn't get this funding to make sure that our elections are secured? I don't. That's why I'm going to vote for this bill. This bill has much needed funding for rural mental health services, for the farmers who are also facing a crisis in the area of mental health. So we're not only helping kids, but we're also helping the farmers in the farm crisis. For your rural members, the bill also has funding for chronic wasting disease. I know that a lot of the Minneapolis and St. Paul legislators probably don't care much about that, probably don't care about the mental health funding for farmers, but that's important to the people we represent. So members, if you care about safe schools, if you care about road and bridge funding, if you care about vulnerable adults, if you care about increased penalties for texting and driving, if you care about protecting kids from dangerous sex offenders, if you care about cybersecurity in our state, if you care about our elections, if you care about our farmers, if you care about mental health in the rural areas, I ask you today to reject this motion to refuse to adopt, and instead you vote to pass this bill, and let's get it signed by the governor, and we can tell the people of Minnesota what a great job we did.
The member from Sherburne, Representative Knoblach.
Well, Mr. Speaker, I want to just briefly respond to some of the comments from my friends on the other side of the aisle. First, Representative Liebling, I don't know that we should have this same debate we had about the single subject rule. I think it was only a week or two ago. But Representative Liebling, you know, I wish you were right. I wish we had a constitutional prohibition that still worked regarding the single subject rule. We don't. You know, this is an appropriations bill. There's no tax items in this bill. When I, a few years ago, sued the governor in an effort to stop the construction of the new Senate office building, I ended up with my attorney going through the past research, past cases, and seen Minnesota Supreme Court cases that mixed numerous different subjects, numerous different committee bills, cases where they said, well, the Supreme Court said this is a bill about appropriations. You got environment in it, you've got education in it, but it's all about appropriations. I thought in that case, well, at least if we've got a tax bill, you know, what if taxes and spending aren't two different issues? I mean, if they're not two different subjects, what is? I thought, well, okay, if you're building a new building, if you're appropriating money for a new building in a tax bill, surely that's got to be a violation of the single subject clause. But what happened, as I told you a few weeks ago, the district court said, no, that's okay. I asked the Court of Appeals to overturn them. They said, no, we agree with the district court. I asked the Supreme Court to overturn them. They said, no, we're not going to take the case. So, Representative Liebling, I really wish you were right, but the courts have held we don't have a single subject rule in this case, in this state. I wish we still did. Representative Hillstrom, I don't see you on the floor, but you talked about a number of good public safety measures that were in our bill when it left the House floor that are no longer there. And you're right, there are some good public safety measures that are not in the bill. One of them was one of mine, a bill dealing with cameras in the courtroom and saying that we don't think it's right to have broadcasts of people in the courtroom when they're going through one of the most difficult situations in their life, finding suddenly their statements on the witness stand being on the 10 o'clock news or forever preserved on the internet. Representative Hillstrom and I agreed with that. We worked on that bill. I was the chief author. She was my lead co-author. Got it through the House, but unfortunately we couldn't get it through the Senate, and that's the way this process works. We just couldn't get everything we wanted with the Senate. I don't recall if it was Representative Hillstrom that mentioned this, but something about the offender health care contract and us not meeting our constitutional obligations because we only appropriated $6.6 million, not the $7.8 million that was requested. Well, actually, there were two parts to that appropriation. $1.2 million of it was for a new IT system that was related to health care, not for the actual health care itself. We are meeting our constitutional obligations of the $6.6 billion that the governor requested. Another representative said something about us cutting agencies. We listened to the governor in putting this budget together. We listened to the governor in putting these bills together. To the best of my knowledge, there are no cuts to agency operating budgets in this bill. That was something the governor was very concerned about. We have, to the best of my knowledge, met his concerns in that particular area. Cybersecurity has been briefly talked about. That is a concern. We do now have a requirement that a certain percentage, 3.5% of the IT budget of every agency is set aside for cybersecurity so that we can try to address and make sure we're on top of this issue. And finally, Representative Mahoney, I need to respond to something you said about this first-time homebuyer program, because this is actually my bill. And it's kind of a complicated area, but members, the state gets several $100 million of bonding authority from the federal government for different home programs each year. Some of it is for first-time home buyers, some of it's for building affordable housing, some of it's for building senior housing. We get this bonding authority from the federal government, and we've got authority to move it into different areas if we want. And we get some significant bonding authority, and we have for decades for first-time home buyers. And you know what? I'm in the real estate business. A friend and I own a real estate company. And once upon a time, many, many years ago, we actually used this program because it's been around a long time. But you know what? We don't use it anymore. Nobody uses it anymore. Why don't they use it anymore? Because the commercial mortgage market, the private mortgage market, has products that are pretty much just as good as the state bonds that you used to have issued to fund people's mortgages. So what does the state do with this money now? What they do with this money is they get this money and they themselves go out and buy mortgages. They're not issuing new mortgages to single-family home buyers. They're buying other people's mortgages, and then they take the money they make on buying those mortgages, and then they help subsidize the closing costs of first-time home buyers. So this is not at all what the program was originally intended to do. It does help some people buy their homes for the first time, but what I am proposing to do with this is we have a huge affordable housing problem in this state. We have a lot of people that are having problems with getting housing. By taking this program, this bonding authority, and repurposing it to building affordable housing, we can build several thousand new units of affordable housing without it costing our state any money at all. We're just using the federal bonding authority to do this. And in regard to the first-time home buyers, the mortgages that they can get on the commercial market are pretty much competitive with this. In regard to subsidizing their closing costs, I will tell you, we had a hearing on Minnesota Housing Finance in the Ways and Means Committee. Minnesota Housing Finance has lots of money. I mean, this is an organization that has got a few $1 billion in assets. If they want to take some of those assets and appropriate them and give them to first-time home buyers to continue to subsidize their first-time home purchase, they've got the money to do it. In fact, I don't know why they don't sell off some of these assets and build some more affordable housing in the state. But they're not doing that beyond the programs that they've already got going. So members, this is, in my view, just a much better use of these funds. It's not middle-class housing, Representative Mahoney. It's affordable housing, people that make 30% of the average median income in their county, people that make 50% of the average median income in the county. This is going to get a bunch of people some affordable housing, some apartments that they don't have right now. Members, I really hope that you'll support this, and I hope you'll vote red on the motion to refuse to adopt.
The member from Hennepin, the Minority Leader, Representative Horkman.
Thank you, Mr. Speaker and members. And Representative Pepin, you listed a lot of provisions, and you said if members cared about these things, then they won't vote to refuse to adopt, and they'll vote for this conference committee report. And I would just say, Republican members, if you really care about those provisions, then you would send them to us alone in a form we could send them to the governor.
There being no further discussion, the clerk will take the roll on the motion to refuse to adopt. Clerk will close the roll. Lesh votes aye. There being 48 ayes and 77 nays, the motion to refuse to adopt does not prevail. Members, return to discussion on the conference committee report. The member from Candy, Ojai, Representative Baker.
Thank you, Mr. Speaker, and it is late. I'll try to be brief, but this was my chance to talk about opioids. And I do want to thank the committee that worked really, really hard on this stuff. $16 million over 3 years is not chunk change. It's pretty good. I did want more. I did want it a little different way, but I will be grateful for what I can get because we have to save lives. And we have to do this way this year. There's some really good stuff in the bill about opioids. We're putting together a program with community paramedics that will reach out to people that end up in an ER room and are brought back to life with Narcan. And right now there is no way to really kind of capture these folks and give them a chance and pull them into some treatment or give them some medically assisted medicine that will help give them a chance to get off these horrible drugs. That's a really good program. There's a program up in Morrison County that's been just lighting up the state with getting more programs out to rural Minnesota, teaching medical doctors, the family docs, how to talk to addicts and how to address them in a way that they haven't been told before, because our family doctors have been so twisted with bad information from pharmaceutical companies. And now we've got to retrain our providers to make sure they know how to talk to patients about pain management. We've got some money for our treatment facilities. chemical dependency folks. There's a lot of good stuff in here. But I will, not mince words. I am disappointed as well that I lost this year to Big Pharma. I failed to bring a bill to the House floor because those folks out there beat me up. And I'm just disappointed in that. I want to thank the governor for fighting hard alongside me and Senator Rosen and Senator Eaton for working really hard on this issue. But I will tell you what gets me is that when you lose something so precious as a child, you start to think about what the heck happened here. And the time after my son Dan passed away, I just had to understand what happened, and I kept reading article after article after article after article to learn what in the hell happened here. Whoops, excuse me. But I had to understand what happened here. My son was not that way, and he had an injury, and he started taking this thing that was called an opioid. And what I've learned since then is the day our world changed with this crisis was December 12th, 1995. Now understand that day, because that's the day in our country that the FDA approved a drug that was brought to them by a company called Purdue Pharmaceuticals. And they gave the FDA this line of information that said, here's our research. We've got this great idea by using oxycodone, this drug that's been used for 200 years, but we're going to have it pure oxycodone, and we're going to put it into an extended release capsule. It's the greatest thing. It's barely non-addictive. It is going to be the answer to everything we ever wanted. And the FDA bought it. Purdue Pharmaceuticals started making money you couldn't believe. They became the 19th wealthiest family in the country only 2 years ago. And that was because of OxyContin. And what also happened then is as soon as their patent wore off 10 years afterwards, you had every single generic company lining right up behind them because they had created the demand. They plowed the pathway to money and cash. You will read it over and over and over again. There's some really bad players in our world, in the distributing world that move our drugs around, in the folks that make these opioids. The PBMs are right in there. They're all making lots of money. And I will tell you, a week before this session started here, on February 12th of this year, I and Senator Rosen and Senator Eaton had a meeting with all of our pharma friends to show them what my bill was going to look like. I was going to try a new approach. I was going to try to be this transparent guy. I got the governor's office was in that meeting too. I'm going to figure this thing out because I'm not going to lose to this one. I can figure this one out. We had a meeting there. It was very transparent. What do you like about this bill? What do you hate about the bill? We had a very good dialogue. The speaker even came in, made it very clear we're going to do some really good stuff with opioids this year. Folks in pharma, you got to figure out how to get to the table here. Very supportive. And throughout this whole year, this session, I have been meeting with them. I've given them ideas. What can they help us with? Why don't you give us $1 million to help us fund the prescription monitoring program so we can help providers and doctors find quicker ways of finding if somebody might be doctor shopping or seeking out drugs when they shouldn't be, and they're showing real signs of addiction. How about you give us $1 million for the disposable bags? You dump the extra pills that you have left over in your medicine cabinet, put it in the carbon bags, you put some water in it. It's a safe way to dispose of these things. Nope, that wasn't good enough either. And I gave them many ideas. And we ended up with nothing. So I really was fighting hard for something. And I really have to tell you that the other body in the same building passed one heck of a bill to go after the pharmaceuticals, 60-6. They said, let's go after them with a license fee increase. Just wanted to make sure that was noted because it was a pretty remarkable vote. Right now, there are 15 other states around the country doing exactly what I'm trying to do too, and what we're all trying to do. We're trying to get this thing under control. But folks, Minnesota has already spent about $150 million in the last 8 years on this epidemic. So it's Minnesota, $150 million, pharma, 0. Let's, as we move forward, keep working on this because we have a lot more to do. Those companies today pay $235 a year to sell all the drugs they want in Minnesota. $235. I sell liquor at a restaurant. I pay $4,500 for my liquor license in one little location. We are missing something here, and I'm just asking my members as we move forward, please pay attention to this issue. Understand it. I am not just an angry dad who doesn't have an oldest son any longer. I am somebody who was led down that path like millions of Americans who didn't get it until it was too late. I'm just asking us to learn about this issue, pay attention to what's going on. This is something that we had a chance to do this year. Now, again, I still have hope. Maybe, just maybe, we'll figure out something. But doggone it, we should not have allowed them to get off the hook. This was a mistake. $235. But I am grateful for this bill. We're going to do some good things. This is going to save lives. So I need to ask the governor to support this bill. We can't let this go down because we've got some really good stuff in here that's going to get to the streets right away. We need to get this help out there. Please, Governor Dayton, I know this bill isn't perfect. It's not what we worked on. I'm sorry that I let him and others down, but this is a good bill. We got to support it. Thank you, members.
The member from Hennepin, Representative Hillstrom.
Thank you, Mr. Speaker. And Representative Baker, I've worked with you on the opioid issue, and I started with you with the penny a pill proposal, and I've been watching the Senate's proposal. In Hennepin County, we are seeing record numbers of deaths. I represent Hennepin County. And a little bit is not enough. This bill does very little. When you look at what's happening in New York, they held Big Pharma accountable to the tune of $100 million a year in a stewardship fund. Who's being held accountable here? The taxpayers of Minnesota. When Big Pharma doesn't pay their fair share, we pay the bill and people die. This is too little. I hope it's not too late.
Further discussion? Further discussion? There being no further discussion, all those in favor of the motion to adopt the Conference Committee report on Senate File 3656 signify by saying aye. Aye. No opposed, no. No. The motion prevails. The clerk will give the bill its third reading as amended by conference.
Third reading, Senate File number 3656, as amended by conference.
Third reading as amended by conference. Any further discussion? The member from Dakota, Representative Hansen.
Thank you, Mr. Speaker. And as we've received this large bill, I've been going through the pages, and it's quite a task. And as I've been going through these pages, I was remembering, and I guess I'm old enough to remember now, when we had a DFL majority in the House, and we ended ahead of time, finished our work, and adjourned before the end. But for the last 4 years, under Republican control, we have had a train wreck at the end of every session. 15, 16, 17, and now 18. But this one takes the cake. This isn't all of it. Now I get asked, why does this happen? Why does this happen? Why do you wait until the end? And I say we don't have to wait until the end. It's a choice. Now, I generally go by a belief that never attribute to conspiracy what can be explained by incompetence. But this isn't incompetence. This is a choice to put stuff in here. The majority leader, who isn't on the, just essentially was challenging us as if this is a campaign, not governing. Challenging the minority about pieces that are in here which we acknowledge are good. That we'd like to vote for because they're good and they'd pass. They'd probably pass unanimously. She was addressing the members, addressing the minority. Why don't we address Minnesotans? I hope everybody gets a copy of this and can take it on the road. Take it home. Bring it to our constituents. Those of us who aren't staying, bring it home as a memento. Bring it to your constituents and see how proud they are of it. I bet you're going to find out they're not very proud of this. Minnesotans aren't looking for this. They're looking for items that are in here that we could pass, but by putting the good stuff in with the junk, into this, at the end, oh, and we knew this was going to happen, didn't we? At the end, we came in on February 20th. We could have started taking some of these things. We did one emergency thing for Minlars. I remember when we used to do it, several things, when we used to bring bills ahead of time, throughout the session, bipartisan bills. Instead of waiting till the end, this is a choice. It's a choice of this management of this House for the last 4 years. Speaker Doubt's majority always waits till the end, and it always results in a mess. And the party of personal responsibility blames the governor. Oh, it's the governor's fault. I don't know how many task forces are in here. I don't know how many working groups. Representative Baker, you referenced the special interests. They're written into this bill. Some of them are very happy. Because in here we give that responsibility to them rather than doing the job that people elect us to do. So we should vote against this. I was going to speak on the concurrence, but these votes don't seem to change during the debate. Don't see a lot of debate. We used to see a lot of debate. We used to see actual discussion. It's my understanding when this was discussed in the committee last night, people just came in and voted. So where was the real discussion? Where were the real decisions made? Who made them? Why? Maybe it's just a function of power, that when people have power for a while, they assume that's going to last forever, and they become arrogant, and that arrogance leads to mistakes, it leads to errors. So I'll address our side of the aisle, that if we get power again, we cannot be doing this stuff. We cannot be doing this stuff. We have to do it differently. And I think Minnesotans are watching. And I think change is coming.
The member from Dakota, Representative Mason.
Thank you, Mr. Chair. There are an incredible number of bills that are in this monstrosity. And we've had a lot of time in the last couple of days where we could have passed a lot of bills independently. Bills people could actually know what the heck we are doing. Going to the opioids, elder abuse, the home health care workers. These are issues we should have all been able to just vote on easily. These are popular bills. People expect us to get the work done. But no, how much effort went into this monstrosity? I don't even want to know. But I do want to put in one last plea for the home health care workers. I don't know about the rest of you, but I went home with a really heavy heart last year when we didn't do something about raising the pay for our home health care workers. Surely on the Republican side there have, and I'm talking to the Republicans because you are the majority, you are the ones that are in charge of governing. I am certainly willing to vote for bills that I think are important. We can't, and I told you this last year, we need to get money for the home health care workers. That industry is in crisis. Is there any one of you that doesn't know a family that is struggling with this, trying to find the workers to help their family member that is a very vulnerable person? I mean, we're talking about the most vulnerable in our society. What does it take to get you to move and get something done? Please, there's less than a day left. There's got to be a way that we can get some type of bill onto the floor so we deal with this. The 7% bill I know is in this monstrosity. Get that out of it too. Let's vote on some things so we get something done before we go home. I don't understand how anybody can go back to their district and just say how little we did this year. Please vote this down and get some bills, decent bills, smaller bills to us tomorrow. Take that back later today. Thank you.
The member from Dakota, Representative Garofalo.
Thank you, Mr. Speaker. Members, very briefly, the morning is early or the night is late. Representative Baker, my friend from Candy, Ohio, I just want to say that I think Minnesota is blessed to have you as a state legislator. I am honored to serve with you. You're one of the finest gentlemen I've served with in the legislature. I want to thank you for your work on this. I think you and I are like-minded on a lot of issues. Sorry about that. Don't mean to discredit your ideas by saying that. But I just want to say that, you know, the taxpayers are getting a damn good deal paying you $45,000 a year. You're a hell of a guy, and I love you, and I'm just really proud of you, and you've just done a great job. Members, I do want to highlight a provision in this bill that no one's talked about. This is the zero emissions plan for Prairie Island. In this bill is up to $45 million of investment to make the Prairie Island Indian community a zero emissions tribal community. In terms of vehicles, in terms of energy usage, it's really a nation-leading plan. I think people forget the fact that many of these casks are located on the Prairie Island Indian community. They never wanted them there, okay? They're literally football fields away from people's residences. For the first time since the inception of this program, this majority is actually going to be helping out the Prairie Island Indian community and doing something positive with these dollars. More money has gone to the Iron Range than it has gone to the Prairie Island Indian community until today. And for that provision alone, members should be voting for this bill. Thank you, Mr. Speaker and members.
Further discussion? The member from Sherburne, Representative Knoblach.
Well, thank you, Mr. Speaker and members. The hour is late. I appreciate the questions and I appreciate the consideration of this bill. You know, if you're concerned about all these things we've talked about, safe schools, restoring the 7% cut to employees who take care of the disabled, funding to deal with the opioid crisis, reform of our vulnerable adult system so that vulnerable adults are taken care of and don't have the sort of situations that we read about in the paper, the Guardian Ad Litem program, more money for road and bridge funding, dealing with chronic wasting disease, more broadband in rural areas, the mental health program for farmers, the expansion of that's in this bill, and also that 340D program that I mentioned that suddenly came up here where our state is threatened with losing $191 million of federal funding for prescription drugs that help those on medical assistance. All these are issues that are in this bill, that are addressed in this bill. You know, if you're interested in trying to take care of those problems, if you are interested in those issues, you know, we really need to pass this bill so that we can actually take care of some of the problems that all of you on that side that I've heard speeches from are saying that you're concerned about. I do want to say that in addition to those issues that we deal with in the bill, you know, there are some other narrower issues for people on the other side of the aisle. For those of you who represent the Minneapolis School District, there's been a lot of publicity about some of the financial difficulties of the school district. There is a fund transfer of $5 million in this bill that is approved and would give additional funding, additional resources to the Minneapolis School District. You know, Representative Lee, I don't know you really well. I don't know if you're on the floor right now, but for a first-termer, no, not Lean, Lee. For a first-termer, you're a busy guy. You got a lot of stuff in this bill. I wish I could see you on the floor, but you, Representative Lean, have some things in the bill, too, and I think that you recognize that. Representative Kanish-Bedin, I know that you were involved in this issue, very tragic issue of setting up a commission to deal with some of the issues of indigenous women, and that commission is in this bill. I could go on. Representative Liebling, Representative Psaki, Rochester has money for their airport in this bill. So members, the hour's late. I could go through other things on the bill. When you see a bill this big, I do have to say that, yeah, it's a big bill. One of the things that happens, though, is especially when you get into the health and human services area and you start opening that up, it creates a lot of pages. And people who are, you know, watching this on TV, if anyone's watching it at this hour in the morning, you know, the way we do our laws around here is you have the current law on the page, the entire current law, even if only one word of that law is changing. So you can have a very large bill like this without necessarily having all that many words relative to the size of the bill in it that are actually changing. There are a lot of provisions in this bill. That's because there are a lot of people who have brought good ideas forward from both sides of the aisle. And I would hope that people would vote for this bill so that those good ideas can be enacted. Thank you. I appreciate your vote.
There being no further discussion, the clerk will take the roll. Clerk will close the roll. There being 76 ayes and 49 nays, the bill is repassed as amended by conference and its title agreed to. Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there are no objections, we will take action on these motions first. Hearing no objection, the motions prevail. Announcements. Representative Pepin.
Thank you, Mr. Speaker. I move that when the House adjourns today, it adjourns until 12 noon, Sunday, May 20th, 2018.
Representative Pepin moves that when the House adjourns today, it adjourns until 12 p.m. Sunday, May 20th, 2018. All those in favor signify by saying aye. Aye. All opposed, no. The motion prevails. Representative Pepin.
Move that the House do now adjourn.
Representative Pepin moves that the House do now adjourn. All those in favor say aye. Aye. All opposed, no. The motion prevails, and the House stands adjourned until 12 p.m. Sunday, May 20th, 2018.